Hi. This evening, an accusation that India is stalling the release of a crucial WHO report. It has come to fore after a recent New York Times piece, but credit where it's due, Amrita Byatnal broke the story for DevX weeks ago. In some sense, it's no secret or surprise that more people have died due to COVID-19 than official numbers would suggest. Globally, India is not unique here in any way. There is enough evidence to suggest that all countries are working with an undercount of the pandemic's fatalities. These images from India last year are a testament to that. Now, the WHO has been trying to remedy this. It has prepared an exhaustive report with global estimates of excess deaths due to the pandemic. What are excess deaths? Excess death means the difference between all deaths that occurred due to COVID-19 and those that may have occurred even before the pandemic. The WHO estimates that approximately 15 million people have died due to COVID-19. The worldwide recorded number is 6 million. That's a gap of 9 million deaths. Of these 9 million, the WHO claims that about 4 million deaths are from India. That is 8 times our current official toll of 520,000. Now, one reason for this difference is that the WHO's figure includes deaths from COVID-19, plus deaths of people because of comorbidities complicated by COVID-19, plus deaths of those who did not have COVID-19 but needed treatment they could not get because of the pandemic. The calculations also take into account expected deaths that did not occur because of COVID lockdowns, such as those from road accidents. India's official tally, on the other hand, includes only reported deaths of people who tested COVID positive, and these are also likely underestimated, for instance, not including even deaths of COVID-19 patients with comorbidities. So if and when the report is made public, the Indian government may have to answer for this. An initial version of the report has been ready since December 2021, but India is pushing back. It says the WHO's process of collating the report was not collaborative, that its officials were not adequately represented. It also claims that the report lacks scientific rigor and rational scrutiny, and that it should be released 10 years later. India has sent 6 letters, held 5 virtual meetings, and sent a huge team of data scientists to review WHO's methodology. What India has not done, it has not submitted its total mortality data to the WHO for the past 2 years. In fact, for 2021, even internally, India did not have relevant data from all states. Such was the disruption caused by the pandemic. So how did the WHO come to India's figure? The WHO researchers have built statistical models from numbers gathered from at least 17 states, including Andhra Pradesh, Chhattisgarh, and Karnataka, which reported at least 5 to 6 times more deaths due to COVID-19 than before the pandemic. These numbers came from registered deaths, either reported directly by the states through official reports and automatic registrations, or by journalists who obtained death registration information through right to information requests. The WHO is not following this model just for India. It has done the same for countries like China, Argentina, Indonesia, and Turkey, which don't collect death data in the same way and have not submitted it either. This is also the model followed by other independent studies and assessments of excess mortality in India, which have come to more or less the same conclusion. In March, the government rubbished the methodology of a study published in the Lancet that put India's death toll at also 4 million. Another of India's core concerns with the WHO report is that it doesn't account for the size and variation in the country. In the study, India has been categorized as a tier 2 country along with Egypt, Indonesia, Bangladesh, Syria, Iran, and the same model is used for all. India also objects to using global covariates such as monthly temperature, monthly average deaths, and income. The WHO has clarified that they didn't use the global covariate model for India and built a separate one for it. But India continues to resist these numbers tooth and nail. At India's request, the report has been reanalyzed and reviewed several times over the past 4 months, but nothing substantial is changing and the WHO is standing by its results. It is not beholden to India, it can release the report whenever it wants. India is also not bound to accept the report. That said, we are of course not the only country that has undercounted deaths or has problems with the WHO report. China, Iran, Bangladesh, Syria, Ethiopia, and Egypt also wrote to the WHO repeatedly about their concerns with their methodology. The WHO report flags significant undercounts in Indonesia and Egypt, and the big elephant, a lack of all kinds of transparency in Russia, also China, for the WHO to be able to calculate accurate global numbers. We don't know what the excess mortality numbers are for China just yet, but we know that it also did not send the WHO any data for this study. But then again, we are not China, right? At Newsworthy, our hope is that we hold ourselves, you, and leaders everywhere to much higher standards. Before I end, a quick COVID-19 update from India. COVID-19 cases have been rising in India for at least 5 days now. It's not cause enough to panic, but it is a deviation in the low numbers we've been recording. 5 states, Maharashtra, Uttar Pradesh, Delhi, Haryana, and Mizoram, are reporting increases in either new cases, death, or positivity rates. UP and Haryana governments have brought back mask wearing rules. The reason for the spike is unclear. Experts reckon it has more to do with states removing all COVID-19 restrictions and a flurry of mass celebrations during recent festivals, but I'll keep you posted if we get any new information. Until then, get all the shots you're eligible for, mask up, and maintain distance whenever and wherever you can in public. I'll stop here. A reminder before I go. Please contribute to Newsworthy and our efforts to bring you journalism that you deserve as a citizen. We need all the help we can get, and if it comes from you, it'll be that much dearer. You can contribute via Scrollstack or Razorpay, the links to which I'll leave in the description on YouTube or in our IG bio. If you're still listening, thank you so much for your time.